The shoulder is a complex multi-directional ball and socket joint which allows movement in many directions. Shoulder instability and dislocation occur when the shoulder capsule is stretched or torn and/or when the labrum is detached from the glenoid. Small incisions are made around the joint. The scope and surgical instruments will go into these incisions. The scope is inserted into the back of the shoulder joint. Saline solution flows through a tube and into the shoulder capsule to expand the joint and to improve visualization. The image is sent to a video monitor where the surgeon can see inside the joint. A surgical instrument is inserted into the joint. It will be used to reattach the labrum to the glenoid using suture and anchor-like devices. After the labrum is reattached, the surgical instruments are removed and the procedure is completed.